Hello everyone, welcome back to my channel. My name is Alice. If you're new, thank you very much for stopping by. So in today's video, what I'm actually going to be discussing is a medical blood test results. So I'm going to basically be giving I want to help you understand your test results when you actually go to the lab and you come back and you see a lot of values and you might not understand them. So basically I want to try to explain in the simplest format possible how you can interpret your test result. Blood test is basically like a way of assessing an individual's health. Now, if you want to know, that's why when you fall sick, your doctors will, okay, you're having fever, you're having temperature. I want to know what's going on inside your body. We cannot see inside the body, so taking your blood samples or going for laboratory tests is a way of assessing your general health, and then these lab tests actually help the doctors confirm their prognosis and make it actually a diagnosis. That's why, okay, from your lab result they can tell you, oh, you have malaria, or oh, your PCB is low, you should eat properly, you should do this properly, you should take more water, or oh, you have anemia, things like that basically. So now there are a variety, there are countless numbers of tests. There are over 50 tests a doctor can request. So there are a lot of tests, from full blood count to EUCR to lipid profile to, I know as I'm saying everything is looking very strange, but now I'm going to start with the most common tests. So for this particular video, what I will be discussing is full blood count. Full blood count. Now that is one of the most common tests that is usually required here in Nigeria. Outside Nigeria, I think they always call it CBC, that's complete blood count, but here in Nigeria we call it full blood count because, you know, Nigerian, we have to be different. Basically, that's just a joke. Now in full blood count, there are three major parameters. Full blood count is a test that actually analyzes the blood cells, the components of your blood. Now let me explain in a different way. Now we understand that your blood is liquid now, but what is just like the blood that you see, you know, when you prick yourself you see a red blood. Now there is something in your blood that makes it red, just like when you see a cup of tea. What makes up a cup of tea is water, milk, sugar, beverage. Now there's a particular percentage of, maybe you want to make a full cup of tea, you put 2 spoons of milk, 1 spoon of beverage, 1 spoon of Milo, 1 spoon of sugar. Now the milk, the sugar, the Milo, those are the cells in the blood. Now the water is what makes up the whole volume. Now so your blood has, there's a water part which is called the serum. Then we also have the cells of the body. Now there are 3 major cells in your blood, which is the red blood cell, the white blood cell, and the platelets. I'll be explaining them in details as we go on. So now let me talk about the red blood cell first. The red blood cell is that thing that gives your blood the red color. So without red blood cell, you will not see the red color. That red color is given, it's just like how milk makes your tea white. And red blood cell gives the blood the red color. And so the parameter that is used to measure the percentage of your red blood cell in your blood is called PCV. That is actually called packed cell volume. Now why PCV is majorly one of the most important parameters people look out a lot for is because the red blood cell, that is the thing that makes your blood red, is what carries oxygen around the body. So if somebody is probably having low red blood cells, like not enough red blood cells, it means the organs in your body are not getting enough oxygen. The oxygen or the air we breathe in and breathe out, yes, that air, it's not just breathe in, breathe out, it's just not your lungs that actually carries oxygen. So this oxygen actually goes into our bloodstream. Also the red blood cell carries the oxygen to different organs of your body. Now so it means if your red blood cell is low, meaning the organs are not getting, your whole system is not getting enough oxygen, and a lot of things also which I'm not going to too many complications, so as not to complicate this video. But basically just understand that the red blood cell carries oxygen. So when the red blood cell or your red blood cell is low, it means something is happening. The organs in the system a lot of things can go wrong. If the red blood cell value falls too low, systems can start shutting down. A brief example: if you're charging your phone and then suddenly light stops, your phone stops charging. After a while the battery percentage start coming down. After a while you notice at a particular percentage, is not everything, basically it's not all your apps you'll be able to do, it's not everything, you will not be able to basically function at full capacity. Same thing with when the red blood cell is low. That's when you see people fainting, a lot of things, and I'll probably list some things, dizziness and all that. So PCV is actually checking the percentage of red blood cell in your body. Now there's a normal range for PCV, for women, for men. Now if your PCV falls above the range or below the range, it actually indicates various medical conditions depending on what your doctor is actually suspecting. Now the next thing I will be talking about is WBC count. Now white blood cells are like a major measurement of the body immune system. Now you can see the body immune system as, you know, as a nation we have soldiers who are actually fighting war. Now the analogy I was using before, the analogy of the tea, the white blood cells are like the sugar. When I say sugar is kind of low, maybe the Milo, but now they are the kind of person that fight against anything. When you have infection, when anything foreign enters your body, when maybe all those times when you get infected with malaria, all those kind of thing, what makes you have fever, for example, is that your body is fighting the infection. Now the white blood cells are the part of your blood, or the cells in your blood that actually fight infection. They are responsible for immune. So when your white blood cell count is higher than the normal range, there's a standard range for all these things I'm talking about. So when your white blood cells is higher than the normal range, it means your body is fighting an infection. And there are actually, now the funny thing is that in the white blood cell there are about 5 different types of white blood cell. So if a particular one is high, it tells us okay, it's a bacterial infection. If the other one is high, okay, it tells us it's a viral infection. If the other one is high, it tells us if it's a parasitic infection, and so on and so forth. But I will not bore you with that. Basically, just know that if your white blood cell count goes way above the range, it either means you're fighting an infection, or you could see it in different cases. And if it's low, it can actually mean different varying conditions. So the white blood cell count helps us to assess an individual's immune system. The third and final cell for this video I'm going to be talking about is platelets. Platelets are small cells that actually help your blood to clot. Now probably you have a clot now and the blood is gushing out. After a while your blood stops, not because that place that you got a clot, not because the skin miraculously healed back. Why you stopped bleeding basically is because there are some cells called platelets that will go to that site of the clot and actually help your blood to stop flowing from that cut site. So platelets are actually cells that help your blood clot. So if you have a low level of platelets, it means someone who has a very significantly low level of platelet of 50. Those kind of people, when they have injuries or when they have wounds, you see the blood keeps flowing, they keep bleeding without the blood stopping. And a normal person, after you bleed for a while, your blood the blood is meant to clot. Such people with low platelet values, they keep bleeding. And then you can see extremely high platelet values in cases of cancer, in cases of some certain infections. So these are the 3 major parameters in full blood count that actually means a lot. So you can check out the normal range depending on your area, as normal range varies slightly depending on location and depending on the people. So you can check out normal range for, so next time you go and check your full blood count, please, I'm very sure if you watch this video from the beginning to the end, you should be able to properly interpret your result and at least have an idea of what your result is saying. So thank you very much if you watched this video this far. If you have any questions about any blood test, please let me know in the comment section down below. I'll be excited to answer these questions. Thank you very much for watching and have a blessed week.